I'd like to say good afternoon, good evening, or good morning, depending on where you are. I also like to say a big thank you to Global Integrity for organizing this session, and I'm privileged to share this out of our esteemed colleagues on issue of the COVID-19 and the effects on the African continent. I work for Accountability Lab, as was earlier introduced, as the Director of Learning in the Liberian Network. Accountability Lab is a group of network that make governance work for everyone by supporting active citizens, responsible leaders, and accountable institutions. So I'd like to start off by saying that about 5 years ago in Liberia, we experienced the Ebola pandemic. And with that, there was a national cry for us to rally in the fight against this pandemic. We lost up to 5,000 lives here in Liberia. Within the three counties, within the three countries, neighboring countries, we lost up to 11,000 persons. Up to 5,000 were from Liberia. So beginning this pandemic, what we try to do as an agency, along with other agencies here, is to look back and see what were some of the challenges that we had, and how can we work closely along with the government in order to improve the social economic impact of what the pandemic will cause on the ordinary Liberians, the poor communities that we work with. So looking back, can you flip to the next slide? So with that, the lab intended to engage along with other civil society organizations to see what key lessons were learned from the Ebola epidemic management that could be very useful. Because within the Ebola epidemic, Accountability Lab and other civil society organizations were actively involved in the social messaging around issues and education that will help prevent the COVID-19. And particularly, we were using music for change, where we were explaining some of the ways that we could protect ourselves and our families using radio jingles and all of that. So with that, Accountability Lab immediately was able to speak to some of its partners, and the UNDP came out to say they needed to support some of the initiatives that we ran before, and so that we should present how we intend to join this fight. So there were two things we clearly told them we wanted to do. We were engaged in facts and rumors in the social messaging front, where we were able to gather rumors from around the country about things that were falsely said about the COVID-19. And then we were able to check with the WHO, the National Health Institutions, the CDC, and found facts and publish that in the weekly bulletin. And then we were also able to organize a big campaign that we call Follow the Money, where we wanted to join in and see how we could support the government in tracking donations that were received and how they were spent, reaching down to the ordinary people. So there were two basic objectives. One was to create a system of accountability and transparency around these donations that were received, and how